Hi, I'm Dr. Monty Palo, and I'm a board-certified orthopedic surgeon. I just wanted to take a moment to talk about different treatment options we have available for carpal tunnel syndrome. So one of the first things I do when patients come to my clinic with the signs and symptoms of carpal tunnel syndrome is try to reduce the activities that bring on the symptoms. So if you know that driving in the car with your hand in a certain position makes your hand go to sleep, guess what I tell you? Don't drive in the car with your hand in that position. If you find that something you do at work, for instance, typing on a computer, makes your hand go to sleep, there's all kinds of options available for you. There's the little keypads that keep your wrist in the neutral position. We've talked about this in the previous video. Again, you want your wrist in this position, not this position or this position for a long period of time. Those little things like raising your seat up or down can make a big difference for the symptoms. So get yourself in a position that doesn't make your hand hurt and doesn't make your hand go to sleep. Take frequent breaks to rest your hands if possible. Again, 10 to 14% of the population at any given time has a diagnosis of carpal tunnel syndrome in the workforce. It's important to take a break and let yourself rest your hands. There are strengthening and stretching exercises you can do as well. And we'll go over this in another video with an actual hand therapist. Now, let's say you've done these things and you're still having symptoms. The next step is to try some splint therapy. You should try to wear the splint as often as possible, even during the day if it's tolerated. Now, there's problems with this, right? Some jobs don't let you wear the splint during the day, and we're going to kind of talk some more about splinting in another video. Start with a rigid over-the-counter appliance, something that fits you properly and prevents prolonged flexion or prolonged extension. Really, the best results are achieved if the wrist is held in the neutral position. Again, the neutral position, you can draw a straight line across your wrist. We don't want it in an extended position. You may want to consider therapy if there's no benefit after 3 weeks. So I typically recommend at least a 3-week trial of bracing, possibly up to 4 to 6 weeks, but at least 3 weeks to make sure you're getting some benefit. Now, other options, people have discussed yoga. Patient who's willing to try yoga, despite the cost, may see some benefit from it. Ultrasound, in cases of mild to moderate carpal tunnel syndrome, ultrasound has been shown to be of some benefit. Other things I recommend to my patient, anti-inflammatories. These are things such as ibuprofen or naproxen. Something that actually decreases inflammation may help some with the symptoms. And again, I'll typically use that in patients who have mild to moderate symptoms. Now, if you've gone through all of these, the next stage might be to try something like injection. The cortisone injections will work typically temporarily. About 80% of patients will have a recurrence of symptoms after an injection, but as a temporary relief, it works pretty well. So those are the major first-line treatment options that we talk about when we are first diagnosed with carpal tunnel syndrome. Thanks.